Hi, I'm Dr. Gary Kim, and I've been asked to speak to you on behalf of Healthy for Life about these new appetite suppressants that are all over the news. As some of you know, I retired from Healthy for Life in 2021. I handed the practice over to Katie and Sylvia, who've been running it very successfully for the past 2 years. They asked me to come back to see patients because they were being overwhelmed by all the people wanting to start semaglutide, which is more commonly known as Ozempic and Wegovy. This class of drugs, also known as GLP-1 receptor agonist, also includes tirzepatide, which is branded as Zepbound and Mounjaro. These medications primarily work by controlling appetite and hunger. They do have some effect on improving insulin sensitivity and improved blood sugar management, but in large part they work because they help you eat less. So not since fen-phen back in the 1990s has there been a class of medications, weight loss medications, that have had such an impact on how we lose weight. And by the way, fen-phen was not a single medication. A lot of people think that there was a medication called fen-phen. It was actually a combination of phentermine plus fenfluramine, two separate medications that were taken at the same time. So compared to all the appetite suppressant medications that have come before, semaglutide and tirzepatide have been shown to be much more effective at helping people lose weight. I, as a doctor, finally have hope that we can turn the tide on obesity and all the weight-related health disorders like diabetes, high blood pressure, heart disease, and even various forms of cancer. So to show you how good these medications are, I've compiled a list of weight loss medications that have been available since the 1950s. The list shows you when the medication was introduced, the average reported weight loss, and whether or not that particular medication is still on the market. And as you can see at the bottom, these newer medications have been shown to be much more effective for weight loss than previous medications. Prior to the introduction of these GLP-1 receptor agonists, we were primarily using phentermine or combinations of phentermine with other medications. Probably the best known combination was fen-phen, which, as I mentioned above, was removed from the market in 1997 due to heart-related complications from fenfluramine. And as good as these medications were at controlling hunger, the average reported weight loss was only 6%. This limited weight loss may be because people would develop or would eventually develop a tolerance to these older medications, meaning that people would get used to the medication and it would stop controlling hunger. However, in studies looking at the effectiveness of Wegovy and Ozempic for weight loss, people didn't develop a tolerance, meaning that they continued to feel a reduction in their appetite throughout the course of the study. Now, these medications are extremely helpful, but like all medications, they do have potential side effects, and the most common being queasiness and nausea. This list that I'm showing you is from the Wegovy website. It lists other side effects, including stomach pain, headache, constipation, and more seriously, but much less frequently, pancreatitis and gallbladder problems. And not all people will experience these side effects, and the degree to which they experience them is highly individualized. And you should also know there is already a lot of data collected on the class of medications. Although the GLP-1 receptor agonists have been in the news a lot lately, they were initially introduced as a class of medications back in 2005. So the safety data goes back almost 20 years. That being said, if you do decide to go on one of these medications, definitely talk to your doctor about the potential side effects. Now, before I go, one last thing that I want you to please remember, this one very important detail while you're working towards your weight loss. As you lose weight, do everything that you can to maintain your lean body mass. That's the amount of muscle in your body. So many people focus on the scale as they're losing weight, and that becomes the all-important measure, and it shouldn't. because you want to lose fat while maintaining as much muscle as possible. On average, people lose a pound of muscle for every 4 pounds of fat. In people who lose weight by crash dieting or by not eating or eating very little, that ratio increases, meaning that you might lose 2 pounds of muscle for every 4 pounds of fat. Muscle is the most important factor that determines your metabolism. If you lose a lot of muscle as you lose weight, your metabolism will drop significantly. And this means that it will be easier for you to regain your weight once you've lost it. Plus, there are many bad health consequences to losing muscle mass, and this includes reduced immune function, weakened bone strength, impaired healing and recovery, and risk of chronic diseases like diabetes. So in order to make sure you're maintaining lean body mass as you lose weight, be sure to take in adequate amounts of high-quality protein. You should be consuming close to 1 gram of protein per pound of body weight, more so if you're doing vigorous exercise. You can improve your weight loss and preservation of lean body mass by doing a mix of cardio and resistance exercises. Please like and share this video if you found the information helpful, and subscribe to our channel to learn more about how to be healthy for life.